The VivaLift is our flagship treatment, and it's really a way of making people look younger and fresher, or sometimes more beautiful, but in a way that makes them look entirely natural. So we're very aware at SkinViva that people want natural, and usually above anything else. So we don't want to change the proportions of the face in a way that makes it clear that you've had some or other procedure done. And the VivaLift is all about achieving that goal. So to understand the concept behind the VivaLift, we need to understand a little bit about how our brains perceive faces. So we've all done it, you've all done it watching this video right now, made an instant assessment of roughly how old I am. It won't be a surprise to you to know I'm not 22, and it won't be a surprise to know that I'm not 55. Now, our brains have done that in a split second. It's almost instant. It's more of a feeling than it is a process of looking and making a decision. You just know it. And knowing that, we can use that to make little adjustments in lots of places that just change that overall feeling. So the idea is that instead of changing something to the point where people say, oh gosh, I see you've had this treated or that treated, they just see the overall picture, and it's a little bit like those days where you maybe put makeup on perfectly, or just your hair's great, or there's just something good about the overall picture that people notice, but they don't notice anything that's specifically changed. And that's the important concept behind the VivaLift, is that you look so natural but somehow better, and that no one can tell that anything's different, but they just know that it's different, it looks different. The VivaLift is really for anyone who wants to look a bit younger or fresher, is often the word people use, but they really don't want to look altered or unnatural in any way. We generally start thinking along the lines of doing a holistic rejuvenation or a VivaLift around mid-30s, often late 30s in particular. And then it goes all the way up to people in their 70s and 80s. The key thing is that each VivaLift is bespoke, so it's not the same procedure when you're 35 as when you're 70, obviously. It's altered to specifically solve the issues at different age groups. The VivaLift is really done with a combination of treatments. We use our premium range of dermal fillers, so it's very long lasting. And we assess the face over a period of about half an hour. We'll normally sit with you and talk you through the options and explain side effects and risks. And then there are up to around 40 points on the face that we can adjust in different amounts with different people. And we do that with a combination of botulinum toxins or Botox, but also with dermal fillers. And there are a range of 5 different dermal fillers that we use in different parts of the face. And piecing it all together, you get an overall holistic rejuvenation that just looks and feels natural. The procedure itself could take up to 90 minutes, and we normally have a good long time talking with you and explaining things through, so that you've got a chance to answer questions. So if we build that into the procedure, it's a little bit longer, but most people tend to have a consultation first, agree and understand the concepts before they then have a procedure a few days or a few weeks later. The VivaLift can be instead of some surgical procedures. It doesn't replace all surgical procedures, obviously, but it does a significant degree of lifting. It can give the appearance of tightening skin as well. It obviously is fantastic at replacing lost volume. And a lot of these things might have been done surgically, but they're done much more quickly and easily and much safer with an injectable procedure, which is how we tend to do it with the VivaLift. So yes, it is a replacement for a facelift for some people. Our doctors will guide you when you book in for your consultation and advise you whether a surgical procedure might be better for whatever your specific needs are, or if there's something they can do with the injectable side. Recovery is quite quick. It's even better these days as we're using cannulas for most of our procedures. So we have an instrument that you can use that basically isn't a needle, so it doesn't cause as much trauma, and that means recovery is much quicker. So most people can pretty much carry on with normal life the same day. You may have a bruise. Bruises can normally last a week, 10 days. If you're unlucky, they can last a month, but that's quite rare, and increasingly more so the better we get with using cannulas in more parts of the face, which is our big area of development this year. The procedure itself, the results will last, we say to expect around a year to 18 months. In practice, there are certain people who would get much longer. I know that one of the early procedures I did, it's now been I think I saw that person about 3 years later, and we looked at her before pictures and they were still better than she was before she had the procedure. So for her, she was getting benefit for 3 years and she was in her 70s. So it can last a very long time. We say expect it to last about a year to 18 months. I think the best thing if you're considering this procedure but you're not sure if it's the right thing for you is to have a consultation without planning a treatment, but to see one of our doctors. So they can then assess your face, talk you through the options, and you can decide with the information they give you whether you'd like to go ahead at some future date. Since every treatment is slightly different, I think a consultation is very important for this procedure.